Hello, my name is Linda. I'm one of the pre-op nurses here at Fairbanks Memorial Hospital. I am one of the pre-admission or pre-surgery nurses that you'll be speaking with prior to your procedure. Today we're just going to go over our pre-hospitalization and surgical process for you. We'll go over pre-admission testing, pre-surgery do's and don'ts, where to go day of the surgery, what to bring, and of course what not to bring, pre-op and operative procedures, and of course post-op recovery. So our pre-admission testing, pre-op registration will contact you to make an appointment to register for your surgery and a time for you to actually speak with one of the pre-surgery nurses, either myself or one of my coworkers. This will include either an in-person visit where you come to the hospital or a telephonic interview with, again, one of the pre-surgery nurses. You may be required at some point to bring your personal ID and your insurance card to the hospital prior to your procedure. Please have a complete medication and allergy list available when we start the interview. Now, during this pre-admission interview, we will talk about your medical and surgical history. We will provide you with education, information regarding the day of the surgery. This appointment is located, if you're coming in, on the first floor of the north entrance surgery tower. And again, you may be here for the visit and actually meet face-to-face with one of us, or it can be totally over the phone, whatever is the most convenient or what your doctor has ordered. First of all, let's talk about surgery do's. Do notify your surgeon if you become sick, develop a fever or a cold, or you've got some type of other infection prior to your surgery. Some patients will be asked to use our chlorhexidine soap wash, and we will provide that to you. You can use that the night before or the morning of, and we will provide that education for you. Make sure that you hydrate before your surgery day. Plenty of fluids until 2 hours prior to your arrival at the hospital day of your surgery. Do take your medications that the pre-admission nurse has talked to you about. Some medications we want you to take. There will be others that we would like for you to hold as per your doctor's orders. Now, some people will need to bring their equipment with them to the hospital. If we have asked you to do so, please make arrangements to have that equipment here at the hospital when you arrive. Now, some of the other surgery do-nots, please don't put any deodorant or lotion, face cream, makeup, or any other nail polish on your person prior to the surgery. Men can shave their face, but please don't shave any other body part, including the operative site. Please don't use any nicotine after midnight, and that includes marijuana. Smoking and vaping certainly irritate your lungs, and we don't want that before your surgery. Please don't eat after midnight. This includes chewing gum, mints, and lozenges. The day before surgery, or if your surgery is scheduled for a Monday, it would be the Friday before your surgery. Please call outpatient surgery between 2 and 4 for your surgery time. You will speak with a nurse who will tell you what time to be here and what time your surgery will start. And that number is 907-458-5690. You will be coming to the north entrance of the hospital. That is our new surgery tower. Please follow the signs as you're pulling into the first driveway of the hospital. Make sure when you come for your procedure that you bring your eyeglasses with an eyeglass case, dentures, your hearing aids, and a rescue inhaler if you use one. Please bring hygiene products, toothbrush, toothpaste, hairbrush, comb, and feminine products if you need. Personal items to include your cell phone and a charger. if desired, and make sure you're wearing comfortable clothes, easy on, easy off. You may be doing physical therapy here at the hospital, and it's always nice to have comfortable shoes and comfortable clothes on. Please do not bring jewelry, body piercings, your iPad, laptop, cash, credit cards, and/or keys. If you're having any prescriptions filled here at Denali Pharmacy, you may need to have a small amount of cash for a copay or a credit card to pay for any of these items. And if you do bring any valuables, they will probably be kept with security, or we may ask you to give those to your loved ones to take home for safekeeping. And up next is one of our pre-admission nurses, and her name is Cheryl, and she'll go over a little more information about your day of surgery.
Hi, I'm Cheryl, and I'm one of the pre-surgery nurses, and I'm going to talk to you about your surgical experience while you're here. On the day of your surgery, you're going to come to the north entrance of the hospital, and that's easily found watching for the big blue signs and the pretty aurora lights on the side of the building. Once you come in, they'll check you in at the guest services desk, and then we'll direct you to the elevator up to the second floor. Up there, the pre-op nurse is going to come and greet you. They're going to put an ID band on you that's going to stay on your arm for the entire time you're in the hospital. They're going to weigh you and measure you and show you to one of the pre-op rooms. They're going to give you some antibacterial wipes to wipe your skin with, and then have you change into a hospital gown. Once that's done, they're going to check your blood pressure, your heart rate. If you're diabetic, they're going to check your blood sugar level, and they're going to start an IV on you. They're going to ask you a million questions to include your name and date of birth, and expect that you're going to be asked that a lot during your hospital stay. That nurse is going to go over your home medications and hook you up to monitors, and just have everything ready for the surgeons. The surgeon's going to come in and talk to you, and that's a good time to ask any last-minute questions. The surgeon, while he's in the room, also needs to initial the correct body part. They will use a pen and put their initials, so there's no confusion about where we're doing the surgery. And you'll also talk to the anesthesiologist. They're going to come in and talk to you about how they're going to keep you comfortable during the surgery. And if your surgeon ordered a nerve block, they're going to talk to you about that. And they may do a nerve block in the pre-op room, or it may be done in the surgical area. But they will discuss that with you, and you'll be comfortable with that. Your friend, your family, or your support person, whoever's with you, can stay with you throughout the pre-op process until it's time for you to go to the OR. Once the OR is ready, they will come and get you and take you by stretcher into the operating room. Your family will be escorted to the waiting room. They'll be given a little slip of paper with a number that corresponds with you. And there's an electronic board in the waiting area, and that tells them where you are in the process. Once you get into the OR, there's going to be last-minute introductions of everybody who's in there, double-checking everything, confirming everything. They're going to position you onto the operating room bed, hook you up to all kinds of monitors, and get you all comfy and ready for surgery. And then anesthesia will take you off to sleep. Next thing you know, you will be looking around thinking, I'm not in the same place anymore. You'll be in recovery. Once your surgery's done, you'll be taken to the recovery area for anywhere from 30 minutes to an hour. The nurses are going to be managing your pain. We use a scale of 0 to 10 for pain, and we want your pain under control. It's important while you're recovering that your pain's controlled well enough so that you can do the things that are necessary to recover. They're also going to make sure that you're warm and comfortable. And they also want to prevent nausea. If you feel the least bit nauseous, let the nurse know as soon as possible so we can help treat that. Now, you are going to have pain after surgery. That's to be expected. But our big focus is managing your pain afterwards. Your surgeon's going to update your family, let them know how things went, and they'll come and see you again. Now, that visit might be a little fuzzy in your memory, but he'll talk to you again before you're discharged from the hospital. And then you're going to be transferred over to 3 West.